All right. So, look, you've been asking me so many good questions. I've got one to start this
Ooh,
episode.
okay.
Claudia, have you
Yes.
gone to therapy?
I don't need a therapist if I have a friend like you. We don't have an elevator pitch. We're like, just listen to us talk for 20 minutes and you'll understand why this
You
podcast is
understand.
called The Mindful Chaos. Yeah, this guy's a therapist, guys.
I just offended everyone.
You're gonna get
The
canceled.
what? The podcast that serial killers hate.
Chaotic.
Okay,
Yeah.
and cut.
So now we know why we're friends. There's exploitation, and then there's friendships like these.
No, but seriously, like, sometimes a lot of people, when they think like, oh, you have a therapist as a friend, like, did you meet that person while you went to therapy, or did
did
you
I
meet
actually
them
ask?
before? Like, how did you meet them? Because they feel like once you become a therapist,
You can't have friends.
you can't have friends.
That's a good point, though. I used to think that almost. It's like they're just lonely people living in ivory houses and they don't communicate with anyone. They just exist in the room.
Yeah. Once you finish that degree, they ship you off onto an island, and then that's just a therapist island.
Or we're like genies in bottles. We come out when they hate us and then we just go back into hiding.
Yeah, like when I'm sad, I'm like, who do I call? Of course I call David. Like, he'll know what to say. Like, who else would I call?
And
Like an accountant? An accountant friend? Like, no.
but we do have friends. Most of them are psychologists, but we do.
Oh, okay. Wait, when we met, you were
The school
a school counselor. Yeah. So in my mind, that felt a little different because
You're not.
I'm not a student.
You're not 16 and a student. Yeah, that's fair.
Even though you would argue that mentally I am.
Yes.
That, the issues that you face would be different between a student and if you were a clinical psychologist, like right now, where you see
Adults.
So I think if we met when you are a therapist, I would, and also before I took the counseling course, right? I feel like I would get a little concerned that whatever I say or do
will be used
might
against you in a court of law.
Yeah.
To
Or you might
rebrand the
psychoanalyze
right
me.
every time.
Yeah, or you're like psychoanalyzing me or like diagnosing me.
So many people ask me that, like especially on dating apps and on dates. They'll be like, "Are you psychoanalyzing me?" Like, haha, and I'm like, "No, I only get paid for that. I don't." Do
Yeah, you wish. You wish this was a free therapy session.
The worst is when someone psychoanalyzes you and they don't give you treatment. How that's like worse than nothing.
Yeah, they're just like, I think you have daddy issues, and that's
and
it.
just leave.
Yeah, you deal with that on your own.
Oh, that's painful. No.
Can you just share a little, maybe like differentiation between, what's a counselor, what's a therapist? Is a therapist a psychologist? And also the difference between all of them and a psychiatrist.
I'll try not to step on anyone's toes. Having been a counselor and then now as clinical psychologist, registrar, I'd say they do very similar things. They're both talk therapy, so they talk to you to try to help you through whatever you're facing. But then I'd say a psychologist and a clinical psychologist, which are interchangeable terms within therapists, the umbrella of therapists. Sorry, not interchangeable because the clinical psychologists require more studies.
Yeah.
And so there's more diagnosis. So we study more about the acute side, the acute presentations of mental health disorders, and then we can diagnose and then refer for more acute treatments. But none of us can prescribe medication. So counselors, psychologists, clinical psychologists, none of us can do that, or psychoanalysts as well. Psychiatrists are those who are actually doctors, and then they study further into mental health treatment. So then they can prescribe medication, and if they want, they can do talk therapy as well.
When do you also know when you need a psychologist versus a psychiatrist?
Ask your therapist and trust their opinion of your symptoms to see whether they would recommend medication. And if they do, because there's a lot of disorders that, talk therapy can do a lot of good, but supplemented with medication, your progress will be way faster.
Oh, okay. That makes sense. So it's not something that you just, figure out on your own.
Oh,
or decide
no.
on
Like,
your own.
I don't know how you would figure it out. No, but for real, do you have a therapist?
I have gone to therapy before I went to counseling course,
Yeah.
and then I have gone to therapy after
Nice.
going into a counseling course. And I think my mindset of going into either one has been really different, just because like before going, even though I did minor in psychology, I don't think, one, I don't remember much of it. It was
Yeah,
decades
me
ago.
either.
And two, it was just really a lot of like theory and a lot of debate on, is it nurture or nature, that kind of
Oh
stuff.
yeah. Theoretical. Yeah, I get that.
Yeah. And so before I took the counseling course and I went to therapy, I also wasn't too keen on doing it in person. And it was during COVID.
Oh
So
yeah.
I used an online app.
Yeah.
You have a choice between using chat, video, or call. And
Okay.
of course, I feel like as a millennial, I'm like, who calls anymore?
Yeah, calls are so stressful.
I know. I can't,
That
like,
could
when
be another
someone calls
topic,
me,
though.
I'll be like, can you just text me?
That could be another
What do you
topic.
need?
Like, why are they? It's so stressful. Like,
Yeah. Why? Why? But it's not stressful talking to someone, but
no,
it's
no. But
stressful
it feels like an ambush
going on a
waiting on
call.
you. It's like, whoa,
Yeah.
I was not prepared to talk to you. And then,
I need to mentally prepare myself.
yeah, I
What
actually
do you need? Is
go
this
over the script before I call someone. Like, good day. No. How are you? Yeah, how are you? And then,
and then you're like, hard day.
good. How are you? So lame. Okay.
But yeah, so I opted with chat only, and I
Hmm.
obviously recognize then and now that it doesn't function as like a full therapy session, and
Yeah.
it isn't as helpful as it could be unless it's in person. And even video, I think, is way better than just through chat. And then after the counseling course, I also had a therapist, and when I went in, I started going through like every single thing that I've learned in the counseling course
Okay.
and like analyzed her,
Oh, you
how she was
you
doing.
pulled a reverse. Wait, what? That's such a cool movie plot. It's like, she didn't know you were analyzing her.
Yeah, and she didn't know that I went through a counseling course, right? So everything that she was saying to me, every question she
Yeah.
was prompting me, and the way that she would analyze me or, guide me to a
Yeah.
thought, it was really interesting. It was a really interesting interaction. I didn't feel like she was the best therapist for me because at one point, I felt like she was trying too hard to be my friend.
Wait, can you give me an example? Like, was she like, "Yo, what's up, dog?" Or
Yeah.
"What's your favorite
Hey.
color?" Hey.
Oh my god, I love this too. Let's go shopping next week. Get in the car, bitch. We're going shopping.
God, that's so creepy.
No, that was a Mean Girls reference.
Oh, yeah, totally. Yeah, because I always understand many.
Yeah, because you know all of it. No, because when we first started, I told her where I work. She was basically like, "Oh, I know some people who work there too," because it's a
Oh,
pretty big company in Hong
right.
Kong. And so she mentioned a name and asked if I knew her.
Okay.
And coincidentally, I did know her, which was really awkward. So I just told my therapist, yes, I know her. She moved to another company already, right?
Okay.
And my therapist basically was like, yes, we're actually really good friends. And in my mind, I was like, okay, this just makes me not want to tell you anything about my work.
Yeah.
And what if she was my boss,
Yeah.
or like what if we had a really close relationship and now I completely feel like I can't trust you?
Wow. She just pulled a self-sabotage by conflict of interest.
Yeah, right. I felt like it wasn't
Well,
that professional.
Yeah, no, I wouldn't do that. I actually don't want to know. I don't want to know who you know. I don't want to know anything about you besides what you want to talk about here.
Yeah, because when we go to therapy, like we're not looking for a friend.
No.
We're looking for someone to help us,
That's a
basically.
good point, though. Like, do you reckon like different people go there for different reasons?
Well, I mean, I definitely think people go for different reasons, but I feel like there are people who might go because they have no friends, so they're like, I need a paid friend.
Yeah. I've heard that for help hotlines, emergency hotlines, mental health hotlines. There's a lot of people
Oh,
because they're lonely, especially at night.
yeah.
If you watch the last episode, you'll know why. But especially at night.
Yeah, that's true. A lot of people call those just because they want to talk to someone.
Yeah.
But isn't that the concept of therapy? Is just because also you just want to talk to someone?
It's hard because just talking to someone, quote unquote, it's very subjective. Like sometimes I want to talk to someone because I want a solution. Other times I just want a good whinge. Other times I just want to complain or empathy or, like that's why we can get into that a bit more of like, what's the difference between a friend or a listener and a therapist?
Yeah, like how do you know when you need a friend and how do you know when you need a therapist?
Mm,
Because I think it's quite difficult to find that line because it's really easy to end up either one being your friend's therapist or
yeah.
you accidentally making your friend into your therapist.
Have you done either?
I have been a friend's. I have been many friends.
Oh wow. Yeah, thanks. This is still personal.
Therapist.
I'm feeling attacked, but also I'm sorry.
No, but in like during the conversations or during the entire process, I don't feel like I'm being a therapist
Right.
until afterwards.
So you don't
Like
do
for
it
example, when
consciously,
you
right?
told me, yeah, I don't like put on my
Yeah.
counselor hat. Well, this was all like before I took the
Yeah.
counselor
Yeah.
course. So go through it. I'm like,
No, but
I
that
want to make
thought
sure this person is okay.
right, but that's like a friend thought as well as the therapist thought. It's not exclusive to a therapist. Like friends can't want the best for their friends.
Yeah. Yeah, that's why I think during I don't feel like I was being a friend's
Right.
therapist.
Right. When do you realize? Six sessions.
It yeah, after 6 sessions of continuously talking about the same
Once
thing
a week.
and
When it's important, you're like you put down a quick
45
note.
minutes.
Oh wait a second.
I'm not getting paid, so I feel like I'm getting chinsed. When do I start charging?
Yeah, that's a good question. We'll answer that later. When to start charging as a friend therapist?
No, that's actually a really good question. I think I don't realize it until it starts to affect me emotionally. Because I think
Oh,
as a
okay.
friend,
Right.
like friend to friend,
Yeah.
their problems you would feel more empathetic towards, and then you would kind of carry that
Yeah.
over to your own day to day. And then when
Right.
I end up spending way too much time thinking about my friends' problems, then I realize, okay, maybe I'm being their therapist now instead of just a friend.
Right. You know what's funny to that point specifically? It's I think much less about my clients than I do about my friends.
Oh, for sure.
So it's like,
Because your friends you care about. Well, not
well,
that you don't care about your clients, but it's
well,
a
you almost got
different
me.
kind of
I
relationship.
tried. Wow. Whew. She's dangerous, guys. This whole thing is a conspiracy.
And then the
No,
quote is
do not
therapists
agree.
don't care about their clients. It's all about the money.
It's all a lie, just to trick me into admitting guilt on the record. That's a
No,
good
but
point. Like,
continue.
you do care a lot about your friends, but then the follow up question, I guess, is of course you care about your friends, and when they have problems, of course you want to help them, and then you care about them even when you're not talking to them. So how do you help a friend without becoming their therapist?
That's a question that I want to ask you. because
Dang it!
because you because you play both roles, right? You just said you have friends.
Brave
Maybe
of you
it's
to
three
assume I have
friends.
friends. Oh, you
Maybe it's the
agree?
hypothetical 3 friends that you talked about in the other
All the
episode.
time, all three of them.
You as a therapist, like how do you separate your friends and you act as a friend with them and not accidentally switch on your therapist mode?
Okay, so there's a difference in my mind of therapist mode and therapist role.
Mm-hmm.
So therapist mode to me just means I will ask questions in a specific way, or I will prompt thoughts in a specific way, or guide the conversation in a certain way that's like conducive to bringing us to a solution or
Mm-hmm.
validate, the normal therapy steps. But a therapist's role would be I will distance myself as a person because my
Oh,
clients don't need to know about me as a person. But with a friend, I wouldn't do that. I'll gladly
right.
share
Okay.
all of my experiences and be like, I would validate them by saying, yeah, go punch them, or like whatever, be myself, That was a really bad example, but like,
Please don't punch them.
right.
Violence is never the answer.
As kids, violence is never the answer. But with clients, obviously, I won't suggest all those things that are more David and chaotic. It would be very much David
Uh,
as this professional suggesting things or validating them in a professional way, quote unquote.
So essentially, as a therapist, when you are a therapist, you are just a therapist. Like David, your personality is like you don't have to agree with the client by sharing your own personal
Yeah,
stories.
yeah, exactly. Yeah. I mean, I would choose to share helpful ones. That's why I always have to
Mm.
choose relevance and appropriateness and timing and all that. But with a friend, out the window. I'll share whatever I want, like with friends.
Do you notice like a difference between before you were a therapist and you made friends and then after you were a therapist and the friends that you make? Like, do
Yeah.
people actually try to be friends with you because they know you're a therapist?
No, I don't think so. I mean, they'll be really smart if they did that, and I wish more people did that, so I'll have more friends. But
Free therapy session.
no, and then they see me and they're like, "Ooh, actually, I'd rather."
Yeah, they're like, oh, I
Um,
have to pay to see that side. Mm.
oh, what? No, I don't think so. And I think my friends actually forget more often than not
Oh,
that I'm a therapist. They'll just think of me as David, the guy they like, or David, the guy they hang out with. But the things I say don't carry the weight of a therapist. It's just another guy.
oh, interesting.
Yeah,
That's actually really good. That means like you really separate
yeah.
the two like not like personalities, but I guess.
I would say not personality, but in my delivery and the way I speak.
Okay, yeah, because like innately you still have the therapist
Yeah, yeah.
personalities, which I think a lot of people assume that it takes a certain type of personality to become a therapist, right? Like people who
Mm,
are maybe
yeah.
more, is it empathetic or sympathetic?
I think empathetic, putting yourself
Yeah,
in
and then
other people's shoes.
which is something that I wanted to bring up too
Mm.
was a research that I found that's been done in 2022. So it's actually quite
Oh,
recent. They did this experiment where they found 103 people globally
Mm,
to basically see how people feel towards their friends becoming a therapist. Participants were asked to complete a story of a friend, we can call her Ash, and a friend called Sam that is becoming a therapist.
yeah.
And the participants are asked, they see the story, which is saying that Sam is becoming a therapist.
Mm,
So Ash is dot, dot, dot. And then people are asked to complete the story.
yeah.
And at the end, some of the three key things I wanted to bring up, one of them was that people actually still think that it takes a certain type of personality to become a therapist,
Right.
which I think we can agree with. Like, there are certain skills that you can learn, but I think there are certain like personality types that is just easier to pick up on those skills and apply it.
Can I ask you what traits of yours think make you a good counselor?
Then I'm like, oh, I think like this, and
Yeah,
that. And you're like, no.
give me a chance, and I won't do anything. I would just not
Now I'm
do it.
scared.
I think I'm great. I think I'm really good.
Well, I think like empathy. I think I'm definitely like able to see from different people's perspective on how they might feel about certain things. I might not necessarily agree with it, but I can understand how they may feel about it. The second one, I want to say listening, but then I feel like that could also just be a skill that you pick up on, like active listening
I think
skills.
curiosity and
Mm,
openness are not as learnable of skills than like just listening skills, like being proactive, asking questions, open-ended questions, and
yeah.
because then not everyone can be curious about something. And how do you learn curiosity? If you're curious about a person, you naturally ask questions, and which you do. And so I don't think it's something you learned, at least for like users.
And I think openness, like you said, is really important because
Yeah.
everyone has different experiences. So you just have to be really open and also mindful that people come from different places and you shouldn't be judging people just because, you don't feel the same.
Yeah.
Another one is that Freud is still thought of as the atypical therapist. Basically, people still think that therapy is about psychoanalysis, but there are actually so
Yeah.
many different types of therapy
Yeah,
treatments.
that's true. Like people still talk about daddy issues, mommy issues, Oedipus complex, and all that. But like that's a separate modality. Like for the record, guys, or for context, there are psychoanalysts and then there's psychologists, and they're different
Mm,
fields. Well, not different fields. They're both psychology, but they're different titles,
specialists.
different studies.
It also depends on what type of therapy treatment you need when you're looking for
Mhm.
therapy too, because not every single therapy treatment works for the situation that you're in.
I mean, they would probably argue against that, depending on who they are. Like CBT would probably say they can solve everything.
Yeah, that's true. Just so the listeners know, so CBT is cognitive behavior therapy.
Well, there's two main elements in behavioral change and mental health treatment. One would be cognitive, so thoughts and feelings, and then there's behavior, so lifestyle changes or choices, career choices, relationships, and skills. So combine them together and you get any sort of behavioral change that you need to reach your goals.
Finally,
Yeah.
a lot of people actually do think that they don't need to go see a therapist if their friend is one.
Really? Wait, actually, people actually think that.
I think it makes sense because, for example, if I wasn't in, like, if I didn't go to counseling or if I never took any psychology courses and I met you and I think, oh, you're a therapist, then if I tell you any of my issues, like, I know you already have the skills and the personality and I know you would be able to help me. It might not be as guided and it might not come in sessions, but, it could also be a lifetime thing if we're lifetime friends.
Wait. So I signed up for something I didn't know for life. That's so good. Thank you. Thanks, man.
Yeah, that's how friendships work, right? I mean, even like friend to friend, you're always helping your friends solve their problems, solve their issues. If my friend is a therapist, then isn't it even better? They already have the skills.
True, but imagine if I don't turn on my therapist mode when I'm with you, but then you're not getting any of the benefit. I'll just be chaotic, making dumb jokes, and then like, see you later, I didn't help you at all.
Okay, so then what about on the flip side for people, because there are people who think that their friend can act as a therapist.
Yeah.
Have you ever acted as a therapist to any friend? Like, you didn't realize it until afterwards?
I've done both. I've done it consciously and subconsciously.
So then how does that work consciously?
So it means I'm like, oh, they need help right now. So I will go into therapist mode.
But would you still suggest them to get a therapist?
Depends. I mean, if it's a long-term thing or if it's like a very big deal that would require multiple sessions, probably, then yeah. But if it's like a crisis, like one-off situation, they lost their favorite basketball or something, then like, I don't know. That's a random example. I don't know how I came up with that, but
you're like, this is the 7 stages of grief.
yeah, I would. I'll be like, your basketball's in heaven. It's really happy. It's looking down on you with love. So, I mean, I would do that for one-off situation.
But I think also for like layman people like me, if I don't have the skills to become a therapist, I think it's a pretty dangerous position to put myself in. Like, it could be a very serious situation that a friend comes to you with. And then obviously I think a lot of people's first reactions would be they need to get help.
Right.
That they know. It's like, if you see someone hurt, you wouldn't
right.
try to treat them yourselves. You'll ask for a doctor.
Yeah.
But then I think with mental health, it's a little harder to differentiate. Like, if I had a friend who came to me every single time they were sad, like, at what point should I just tell them, hey, maybe you need a therapist and not me?
Yeah, that's a good point. Like, I wouldn't know either. I think, would it be if it's once a year, I'm like, maybe that's fine.
That seems okay.
Yeah, that seems okay. But if it's every Christmas or every time it's their birthday, then those are like red flags where I'm like, it seems like a pattern for sure. So maybe you can address them with a therapist so it's not a pattern anymore.
Okay, so then as a friend, do you think we should try to see if we can identify these patterns and then set boundaries? Because it's quite difficult.
I mean, if you that's systematic about your friendships, then I think that's ideal. Yeah, but a spreadsheet of all your friends and they're like,
when do they find me? When they have when they're sad. Well, I mean, some of my friends used to come to me all the time for relationship advice.
I did too. Yeah, that you go with those. Yeah.
Yeah. So then, at what point should I be like, maybe you should see a couples therapist?
Oh, they're already in relationships. Okay.
Well, I guess or for example, like if it was you, you came to me all the time for relationships.
Yeah. Yes, I did. Take me for an example, right? If I was coming to you every Friday and Saturday nights, like being depressed or whatever, then I'd say probably suggest I go find someone.
I think the issue, especially in Hong Kong, is that a lot of people it's not confrontational, because I don't think this counts as confrontational. I feel like confrontation is more aggressive.
Right.
But just trying to tell someone that they should go
Directly.
see a therapist sounds like an insult.
Oh, well, in our culture, definitely, right? It's
Yeah.
almost like saying you're
Because people
crazy.
think, yeah, exactly. So even I think even now, like with our generation,
Mm,
it's still a little touchy
really?
topic to tell a friend to
Okay.
be like, hey, have you gone to therapy? Because
Yeah,
it
yeah.
still sounds like, well, you have issues that you need to solve. That's why you need to go to therapy.
That's a good point. But then when you explain it like that, in those words, you have issues that you need to be solved. I'm like, duh.
Yeah.
Like, I'm,
Oh, yeah.
of course I've got issues that need to be solved. But then when you say you should talk to someone or have you considered therapy, suddenly it sounds so serious. And I'm like, oh, it's not that serious. Like, there's a
Yeah.
part of me that jumps at that to like defend myself almost.
Yeah, because you're like, well, I think I can solve this on my
Yeah, yeah,
own. Like, I don't need to
yeah.
see
I've got
someone.
friends,
Yeah, exactly. I've got friends.
three of
I've
them.
got a friend who's a therapist, so
Yeah,
I
yeah,
don't need
yeah.
to pay a therapist.
I think it's a related point, but it's a much bigger point.
Yeah, because it's like if you're like, well, I have a flu, and if someone's like, go see a doctor, you don't get offended.
Right, right. I
You're not
think
like, I can take care of this myself.
because
What do you mean?
we got the stigma where a shrink is just for very serious mental health issues.
Yeah,
And then because the severity of mental health issues is so subjective, we think that we don't want to be associated with that upper echelon of this is the worst level, the DSM 5 level of mental health.
yeah,
I mean, just the word
yeah,
disorder itself actually is not a
yeah,
positive connotation. Like, oh, great, I'm going to be diagnosed with a disorder. Like, who wants
yeah.
that? Like,
And that sticks with you for life, right?
yeah,
Like you'll always be that person who is diagnosed with OCD or
right, right.
ADHD.
I mean, a side note would be I'm not against diagnosis. I'm not against those labels, but when they can help.
Yeah.
So if it helps to get proper treatment for a cluster of symptoms, then fair, then it's good. But if you just come up to me and tell me, David, you got OCD, and I just run away, like thanks. Now I got one more problem to add to my pile.
And then, or it's also just the stigma of having a
Mm,
diagnosis. Like
true.
people will be like, oh, OCD, that must mean you're blah, blah, blah.
Right, right. And I think having a therapist or going to see a therapist adds to that label. In
I
Sydney,
agree.
is slightly better. I think Sydney, we're pretty open minded and we share all the time that we have a therapist, we go to therapy. It's becoming destigmatized. I don't know how it is in Hong Kong, though.
Yeah, I love that. I don't think it's there yet in Hong
Mm.
Kong. I have some friends, but they're mostly, Canadians as well. So then
Oh,
we'll openly talk
right.
about like, oh, have you seen a therapist? Or,
Yeah,
what was your experience? And we talk about it because
yeah.
at the end of the day, it really is just like a paid
Yeah.
friend.
Well,
Well, someone that you pay that you can tell basically anything you're comfortable with, and knowing they would not be able to share that with anyone else
yeah,
unless it's something illegal.
yeah.
Um,
With a friend, you can expect them to give right and wrong advice, and they don't really have to be very professional about it.
they can say whatever, and
They can
then
literally say whatever.
that's it. Yeah.
So yeah, and then you won't blame them either. Like you don't go back and say, "Bro, last time you told me, and then it didn't work out," or
I mean,
did you do that?
some people, some friends might use it against you, I
Oh,
feel,
really?
but that's
Okay.
just their personality,
Oh,
maybe.
but with a therapist, I guess I mean, the onus of responsibility or duty of care is on us to be professional and to say helpful things as much as we can. So that's so much more weight to it that you can kind
Yeah.
of trust us more in that sense. Even though friends care
Yeah.
more about you, so you can trust their intentions. That's the funny thing is like, I just noticed that you can trust a friend's intentions more than a therapist's intentions because not the therapist will never love you the way your friends love you.
What?
I'm sorry, guys.
But I
I'm
paid
sorry.
them.
I know you paid a lot of money, but love cannot be bought.
Yeah, but I can still say that a therapist will have my best interest in mind.
Yeah, absolutely. Even more than friends sometimes, because that's our
Oh, I
profession.
agree.
We have to uphold that. Like that's our only job, really.
Yeah, I agree. Because I think even with friends, sometimes we might have our own agenda
Oh yeah, yeah,
when we're giving advice to our other friends.
yeah,
And
yeah.
obviously, we all have our subjective, objective opinions.
But friends have no
So that
duty
is
of care
definitely.
to choose the most objectively good thing for you when they give advice or when they talk to you. But for psychologists, like that's our only job is we have to measure every word we say against that metric or that objective.
Kind of one final question.
Yeah.
is I think a lot of people, when they search on Google too, when you type in "do therapists," one of the top three searches is "do therapists make good money? Do therapists have therapists? And do
Oh,
therapists take insurance?" So I think
I can answer
it'll
all.
be quite interesting. I don't think we need the other two, but I want to know if you have a therapist.
I do see therapy as much as I can afford because therapy is expensive.
As a therapist
Mm.
seeing a therapist, do you think you have more requirements for your therapist
Yeah.
than a normal person?
Yeah, probably. Like I will know what they're doing. I will know how good they're doing it, probably, and then I will have higher expectations. And also, there's things where that's the interesting thing where sometimes in therapy for therapists would segue into us dealing with our own clients or our work, and so it's more than just
Oh.
personal. It's weird because we have a term in psychology where it's the therapist as a person. So we bring ourselves. That's our biggest asset, and our biggest part of treatment is our authentic selves. So we actually cannot
Mhm.
separate personal therapy from professional therapy.
Oh, okay. So, like, when you go see a therapist,
Mm,
a lot of your personal things that you bring up might
yeah,
actually
overlap.
relate to
Relate to or overlap.
your job.
You know countertransference, right? In therapy, but then you can't talk about it, you can't address it in the moment because it's something that your client says that brings it up in you, and so you have to find some way to deal with it yourself. And so who do I talk to? Well, it's hard to talk to a lay person about. Hey, I was helping this person with depression, and then
Yeah.
my childhood memories came up. So how is
Yeah.
their day? You know, like you can't talk to anyone about those things. So you either
Yeah.
talk to your own therapist or to your supervisor or to your peers in peer supervision. But then
Yeah.
the difference between a supervisor and your own therapist would be very blurred in those moments of countertransference. Because are you dealing with yourself or are you dealing with your therapist role?
Yeah, because I would assume your supervisor would give you maybe advice or guidance on how you should react as a
Yeah, yeah,
therapist.
yeah,
But then your therapist would be helping you on your personal
yeah,
emotions.
exactly that. That would be this very nuanced differentiation. But then it depends on how your supervisor works and then how your personal therapist works as well. Some
Yeah, oh my
supervisors
gosh.
are really good at digging deeper because they truly believe in, well, I'm helping you as a person, and I believe by doing that, that will make you a better therapist. So
Mm.
those sessions I love because, or those supervision sessions I love personally because it feels like I'm doing personal work, but that's making me a better professional.
That seems like a very thin line, like
Oh,
a super gray area.
some might argue there is no line there.
It's just a whole like it's just all like fused together into
Yeah,
one. And but then as a therapist, you sometimes still have to try to separate your own personal emotions versus you being a therapist. Like
yeah,
if a client is crying
yeah,
during your session and then you feel those strong emotions, maybe because you've also been through something
yeah,
similar, do you have to control your own emotions as a
yeah.
therapist, or can you also just cry with them?
I do both. So I can control when I cry or not, and I let it out or
Mm.
not based on whether it will be helpful for them in the moment. So sometimes, when you cry, you would rather the listener cries with you than if it just stare at you. Then fair. I'll
Yeah, they'll
get
be like, why are you crying? That's what I will feel if that person just stares at me.
right.
But or at least maybe they need some emotion on their face.
Yeah, some
Like
emotion,
look sad.
concern or sad. Yeah, yeah, yeah. But then sometimes, like, there's a point where you don't want your clients having to take care of your emotions,
You
right?
cry harder
You're
than
crying
me.
harder than you, then it's like, whoa, okay, sorry.
And then I'll
Are you
switch
okay?
on my counselor mode. Like, I'm sorry, did we talk about something that hurt you?
Yes, but it's okay.
Do you want to talk about it?
I do, but I won't. Yeah,
Wow,
so
that's
it's a
so
fine
much.
balance. Like, you
Yeah.
only you will know in that moment what you need to do.
Yeah, and it's honestly such a difficult job. It's so much more than just
Oh,
talking to someone. Because
I
in
love
my
it
course, we've done role
wish
play.
I wish we can just talk all day and get paid for it. I'm like, bro, you have no idea what I do.
Seriously, I think a lot of people think like, well, you just talk to that person and then you try to make them feel better,
Right,
right?
right.
But I've done a role play in my counseling course, and there's so many things that you need to have in your mind while the other person is talking, and you need to be active
Yeah,
listening, but you need to plan out what you're going to
yeah,
say or prompt
exactly.
them to think next.
Yeah,
And then you also have to have emotions on your face.
yeah,
Like someone told me when they were watching the role play, she
yeah.
was like, you should smile a little more.
Dude, smile a
She
little more.
was
You're
like,
depressed. Why would I smile?
no, because she said when I'm listening, like when I'm active listening, I do this thing with my lips where I purse it together and it makes me look like a mean girl.
Oh, like you're judging them.
Yes, exactly. I was like, no, I'm just thinking.
Yeah, I'm thinking really hard. I'm trying.
Yeah. I'm trying to not show like how
Yeah.
hard I'm thinking.
For the record, guys, if you talk to a therapist, your therapist is actually thinking about everything as they listen to you. They're not just listening to you.
But they are also
They
listening to you,
are
which is
also.
such a crazy concept of how you multitask in your mind.
Yes. I'm surprised sometimes that I'm able to do it when I'm like sleepy or not in the best mood that day. Yes, we do get sleepy, guys. Like therapists are humans too.
You guys are robots.
After lunch, we're like, oh my gosh.
Wait, one last question. This one's a super easy one. This one's super easy one. A therapist or a friend? Which one is better for your mental health?
You know the answer. It has to be both.
It has to be both. You can't have just one.
So many people only have friends. Not many people have.
But I think a lot of people would benefit
Yeah.
a lot more
Absolutely.
with both.
Yeah. I think that's 100% true.
And because I think going to therapy also lets you become a better friend, and then it helps foster those friendships.
Yeah, that's true.
Red flags, green flags. It's a new segment, okay?
Red flag, green flag. When you try to fix all your friends' problems.
I think it's a red flag.
Green, right? Green. So green.
Yeah. You think it's a green? I think it depends if the friend is asking you, like if all your friends are asking you to fix their problems, but no one's ever asking you to fix their problems.
Yeah, that's true. And it's like all your friends' problems, that's a bit extreme, but
yeah, I think all your friends is a bit extreme.
Yeah.
Maybe a few. I think the other thing is you should ask your friend if they are venting to you, if they want a listener or they want someone to solve your problems.
Do you actually ask that?
I don't, but I should. I tell my friends when I vent. Because I had a few fights with one of my best friends before, because I would vent about my emotions and he would try to give me advice. And I'm like, no, I don't need advice. I just need you to listen. I know what I need to do.
Yeah. That's so good. Setting boundaries and needs.
Yeah, but I guess like I should do the same too and ask a friend, like, listen, do you want me to listen or give you advice?
So I think it's actually a green flag in terms of your motivation and how good a friend you are. If you want to fix all your friends' problems, you're a good person, you're a good friend. But in practice, that would be a red flag.
Yeah. No one asked you.
Yeah.
Why do you think you're better than us?
Yeah.
Why do you think you have all the solutions?
Whoa, that's an assumption, but okay. Next one. Red flag or green flag? A therapist who tries to be your friend. I think we know the answer to that, Claudia.
Red.
So red.
I think a therapist can be friendly.
Yes.
But they should never try to cross the line.
Yeah.
And build rapport in a way that makes you feel uncomfortable.
100%. And like, I think everyone defines friendship slightly differently, but come on, we all know the line when someone's trying too hard to be your friend or trying to connect with you in ways outside of therapy that's like irrelevant.
Yeah, I think that's the main line. Like, I don't need to know who you know outside of this room.
I don't need to know that you go to run clubs on Saturdays too. Like,
yeah, I don't need to know that I'll see you outside of this room.
Yeah, I don't want to in fact see you outside of.
Yeah.
And last one, when your friend tells you to see a therapist, is that a red or
green flag?
Yeah,
definitely green flag. I think. Well, I mean, obviously, it depends on the way that they say
I was gonna say that.
You need to see a therapist. Yeah, like, do you hear what you're saying? You need a therapist.
Well, yeah, that'll be painful.
No, but I think we should normalize having these open conversations and really not take into offense when someone asks if you have a therapist or, suggests you to see a therapist.
I
It's not an insult.
I agree. It's not really like, how would you think that's an insult? If they deliver it right, then it's just a way to help you, right?
Yeah, but I think the main thing is a lot of people don't think that they have problems or issues that they need to go see someone with,
Right.
especially because when it's with mental health, like it's all in the mind, right? Like
Right.
you're not like, yeah, I'm bleeding, obviously I need to go see a doctor.
Mentally bleeding, yeah.
Yeah, like you're crying, like you're literally you have a tear coming out of your eyes.
Tears are our minds.
Our blood.
Yeah.
Our mind's blood.
Oh, that actually sounds really gross. Never mind. That felt like a better idea than saying,
No, that's no.
Sorry.
That's a red flag.